everyone. I'm Allison, and you are listening to Play It Forward on WUSB Stony Brook 90.1 and 107.3 FM. Happy Friday, everyone.
Happy Friday.
Happy Friday. So joining me live in the studio are the hosts of Play It Forward, Kurt, Taylor, and Chloe, and we have our special guests, Steve Chassman and Adam Birkenstock of LICADD, Long Island Council of Alcoholism and Drug Dependence. We extend our special thanks to Matt Wise, WUSB's new program director and the engineer of our show today. Thanks, Matt.
Thank you, Matt.
Before we interview Steve and Adam, here's Taylor to tell you about the show Play It Forward.
Hi, everyone. We are a not-for-profit organization devoted to enlightening minds about the fentanyl opioid crisis. Play It Forward aspires to shatter ignorance, ignite empathy, and forge a resilient society as the demand for recovery is so significant. Every other Friday at 1 to 2 Eastern Time, we broadcast from Stony Brook University radio station, and we discuss fentanyl. Along with this, we conduct live interviews that magnify varied viewpoints of community members. So, Play It Forward offers a platform for individuals to share personal stories, impactful experiences, work, and valuable resources that they have related to addiction, prevention, harm reduction, and more. On Instagram, you can find us at sbu.playitforward. Also, if you would, show your support to us on YouTube. Our channel is the Play It Forward Project. With this, tune in and be part of the conversation. Now here's Kurt with some vital information about fentanyl.
Fentanyl is a synthetic opioid that has recently been claiming the lives of approximately one person every 8 minutes. Fentanyl is commonly employed for medical purposes such as surgical procedures. However, it is crucial to differentiate between medical fentanyl and the illicit variant found on the streets. Today, fentanyl poses the gravest threat to our nation has ever faced regarding drug-related fatalities. It is the number one cause of deaths among adults ages 18 to 45. The illicit substance originates mainly from Mexico, which capitalizes on inexpensive precursor compounds sourced from China. The main driving force behind fentanyl production is a financial profit. As a result, synthetic opioid is mass-produced and easily obtainable in the market.
In 2022, the Drug Enforcement Administration seized over 57.9 million fentanyl-laced fake pills, as well as more than 13,400 pounds of fentanyl powder, which is the equivalent to 400 million lethal doses of fentanyl. The 2023 fentanyl seizures amount to nearly 78.1 million deadly doses. This alone is enough to give every American a lethal dose. In fact, the number of fatal fentanyl poisonings that occur per day in the U.S. amounts to the occurrence of a commercial jetliner crashing every single day. Yet another comparison is the scale of 9/11 happening every 2 weeks. There is a significant lack of media coverage for highlighting the true extent of the fentanyl crisis.
This is exactly why we present this show. Illicit fentanyl is added to many street drugs such as heroin, cocaine, and meth to increase profits and potency. It is also being hidden in pressed pills and made to look exactly like Adderall, oxycodone, and Xanax. Just 2 milligrams of fentanyl can be deemed a potentially lethal dose, making it especially hazardous for individuals who lack tolerance to opioids. A single pill can be deadly and unfortunately is not a safe time to experiment with or trust any pills that were not prescribed to you, regardless of what may seem like valid medical motivations.
The DEA has discovered that 6 out of 10 pills containing fentanyl may carry a potentially lethal dose. This finding reminds us to be extremely cautious and attentive when dealing with substances of this nature. Also, please stay tuned. We will provide free confidential outreach resources and substance misuse and harm reduction support.
Were you aware that over 200 people die every day from overdoses related to synthetic opioids like fentanyl? According to the Center for Disease Control and Prevention, in 2022, there were approximately 117,500 overdose deaths, which were primarily driven by the spread of illicit fentanyl. Now that we are familiar with this problem, here is Allison to introduce our guests.
I'd like to welcome Steve Chassman and Adam Birkenstock of LICADD. They are both licensed clinical social workers who are doing amazing work in our communities. So on behalf of Play It Forward, we welcome you and thank you so much for being here with us today, and of course for your work and commitment to the community. So welcome, Adam. Please tell our listeners, and Steve, of course. We're going to let Adam go first because, Steve, you've been on the show before. But welcome, Adam. Please tell our listeners a little bit about your role at LICADD.
Thank you so much for having me. So, what I do at LICADD, I am the director of programming. It's one of those titles where when you search it online, you think that I work with computers, but I only do when I have to. I am in charge of whatever we do in the community and what we do in the office. So that includes all of our clinical work, which is wide and varied, and I don't want to take the whole show to explain everything that we do, but also in charge of making new programs. One of the things that I say a lot is that LICADD has reinvented itself every 7 to 10 years. When the field changes, when a new problem arises, like the problem of fentanyl, then the approaches we need to change too. And that means that we need new programs, we need to retire old programs, and we need to get trained in new things. And that's part of my responsibility with LICADD.
Wow,
that's awesome.
Awesome work. Thank you, Adam, and welcome. And welcome back to the show, Steve. Please tell our listeners about your latest work since you've been on. It was actually in February.
Oh, well, thank you. It's always a pleasure to be here. And listen, I'm always in awe and wonder of what you, Allison, and your students do here.
Oh, thank you.
And you're part of the solution. And I think we're not going to beat this on supply. I think we know that drugs are coming into this country at all kinds of innovative ways and rates. We need to beat this on supply. And the truth is Americans consume 80% of the world's narcotics. And if there wasn't a demand here, the supply would go away. So, we commend all of our partners in law enforcement, federal, state, and county, doing everything they can to keep drugs off the street. LICADD has absolutely no love for drug dealers, but we know there's a lot of people in the grips of substance use, opiate use disorder right now as this radio show is going on. And LICADD for 67 years has just been here for individuals and families. Should that time come and that all magic line, I can't do this anymore, LICADD and all the clinicians that Adam heads up are here to help individuals and family find their way home, so to speak.
Wow, you guys do great work. Thank you so much for being here and for the amazing work you do. So we all have some questions for you, and here's Taylor to start.
I have a question for Adam. So I recently learned about SBIRD, which is a acronym for Screening, Brief Intervention, and Referrals to Treatment. Adam, can you enlighten us about SBIRD at LICADD?
Yeah, absolutely. So SBIRT is not fun to say. I think it feels a little weird, right?
Definitely.
But it's easier than saying the whole thing. SBIRT has been one of our constant programs throughout our history. As soon as we began doing it, we knew that it was going to endure in whatever size and shape, because there's always going to be a group of people, whatever addiction they're gripped by, whatever situation they're in, they're not ready to say, yes, let the healing begin. Often we're not, right? But they are ready to say, okay, I'll have a conversation. I often say that's the no requirements conversation that you can have at LICADD.
I like that.
We're not saying, yeah, right? It's a good intro.
Yeah.
We may not be the door that you need to walk through, but we'll walk you down the hallway to the door you need to. And that's what SBIRT is really meant to be. It's an evidence-based model. It's 1 to 5 sessions generally, although it can be as little as a conversation, which is sometimes what you see in other settings. For us, it is a quick assessment and then follow up to say, if you're not ready to make this step now, let us help you understand your situation better. Let's help you understand what help means and how to access that help. And we'll walk with you through that process. Everything from this is what addiction is, this is how it's impacting your life or not, and this is what it means to make a phone call. We can make that phone call.
Do you find that a lot of people are just really uneducated as to, like, what am I going through? I didn't even know I was addicted.
Yeah, less now. I think that education has come a long way publicly. You find a lot more people willing to say, I'm sober, this is my journey, I'm proud of it, or, I'm not sober, but addiction was a problem for me, or substances were a problem for me. So there's a greater lexicon for people. But that being said, there is a challenge that we need to address of, I don't know what treatment exists. I don't know what treatment is like. I don't know what my insurance is or how it works. And so that's a big piece now of the SBIRT that we do.
Do you find that SBIRT is used a lot within the hospital settings, like in an ER after somebody has an overdose? Because I would think that would be an excellent opportunity where motivation might be high for change.
Yeah, absolutely. And more over the last, I would say, decade, that's probably pushing it. Maybe over the last 5 to 7 years, you've seen more and more SBIRT. I will say, SBIRT, because of the nature of the setting, it's not 1 to 5 sessions. It's, hey, you came in because of this. can you answer 2 to 3 questions? Okay, sounds like maybe there's an issue. Here's some resources. Or in some settings that have the infrastructure for it, hey, here's a peer to be able to speak to you, someone who's gone through what you've gone through, who's got the training. Let's get you connected to a good conversation.
And if I can just add on that, to Kurt and your question, Chloe, if there's one defense mechanism that's synonymous with substance use, it's denial, that people don't really see where they're at. Some of that is just human nature. I mean, I can't see myself. I need other people, in this case, qualified professionals, to see us. And when we're screening, we're really assessing not what they think drugs are doing for them, and never forget that opiates mask pain, emotional and physical pain, but ultimately, what are drugs doing to them? And there's several life areas that Adam and the team look for when they're screening: physical, psychological, interpersonal, their relationships, academic or vocational, their financial health, because all drugs, last I checked, cost money. And the last one is craving. Do I crave these synthetic anesthetizers at certain times of day or certain emotional states? So, and when you talk about intervention, what are we intervening on? The disease progression. Recreational, if it exists, recreational substance use, mild to moderate substance use, and then ultimately into dependence and severity of what is a bona fide psychiatric condition. So to Adam's point, we've been doing that for 67 years and doing the warm handoff. Some of that stuff we do in-house. And to Adam's point, if they're not ready to give up their emotional crutch, they talk about other things that affect all of us as human beings: relationships and money and past traumas, fears of the future. So Adam and the team are on call 24 hours a day, and they do an exceptional job.
Going back to May, Fentanyl Awareness Day, Adam, what key takeaways from Fentanyl Awareness Day would you like to ensure our listeners are informed about?
Sure. I think that Fentanyl Awareness Day was great because it was a wonderful opportunity to see, one, hey, this is a big problem, we need to talk about it. And two, from my angle, it's great to see a partnership happen between families, between individuals who are impacted, with local government, with federal, really. I mean, the DEA is involved to say, yes, fentanyl has been killing people for a decade now, maybe more. I mean, synthetic opiates lead, the deaths when it comes to accidental poisonings. We call them accidental overdoses, all of these things. It is critical to see that it's not just one person leading this. It's not just a family member crying alone or reaching out for help, but it's the family in touch with the government, in touch with people who can make change, saying we all need to be gathered around doing this. It was really impactful. There was a narcan training there to help say, listen, even if there is another accidental poisoning, we can bring this person back. There's treatment available. It is so important for this community work to be done, really.
Adam, can you please explain the school sessions you conduct regarding stress and resilience and the importance of coping skills, especially amongst teen population?
Sure. Yeah, it's this holds a really special place in my heart. This is some of my favorite work. Steve is often telling me, aren't you the director of programming? Why are you in a high school right now? Or like 18 times this week, right? And this is part and parcel of what I'm talking about with the Overdose Awareness Day, too. When we have more than one part of the community working together, the better everything gets. So when we as a community health agency get to interact with the schools, get to teach not only teens about, hey, we may be talking to or mentioning that there's some risks when it comes to substance use, but then also saying, listen, I know you're probably not going out and looking for fentanyl. You are 12. Hopefully you're not. But maybe you are looking for a way to relax because school is the leading cause of stress in a teen's life. So if you have a way to look for that stress relief in a healthier way, that skill is good and meaningful and important for you to have. And that includes things like, who's your best friend? Because if you can go out, often it's easier for me as an outside person rather than someone who works at a school to come in and say something like, when you go to a party, can you or your best friend come over and say, hey, he's good, he doesn't need a drink?
Yep.
Because that's something that's hard from a school
support,
standpoint
right.
to have liability in saying, but I can more easily say, and that's the thing that's going to save a kid's life or save a kid from walking down that path that he doesn't want to walk down.
That's
I
awesome.
joke,
Yeah.
you don't want to be sitting in a room with me. I'm pretty boring to go through addiction treatment with, but hopefully you don't have to get there because you listen to me now, right?
And to that point, I mean, listen, LICADD's been pulling people out of the river of substance use for over 6 decades on Long Island. Adam and the team that go into over 100 schools and talk to students from K through college, we know that for them, drugs become a viable option if they cannot manage their emotional state, if they don't have the empowerment to feel like they can manage an abundance of stress. Let it be known that the governor of New York State came out and called it a bona fide public health crisis around the mental health for adolescents and young adults. So LICADD already kind of firmly footed in what we call evidence-based prevention. And it's not the drug talk early on. It's managing your emotional states. It's learning what emotions are. It's having and developing healthy coping strategies. Mm-hmm. It's having the communication skills. Mm-hmm. Also, and I think Adam's one of the best trainers in the region doing this, but, what does digital mental health look like? These cell phones that we've silenced for this show don't really give a hoot if you're stressed or not. In fact, whether we are aware of it or not, some of the news cycles and the inundation of so much information and comparisons probably is adversely impacting our mental health to some capacity. So being able to ask the right questions, technology is not bad. There are unhealthy ways to use it. And I think Adam and the team talking to young adults or tweens, it's really important to know as they're immersed as digital natives what quality mental health looks like, so drugs become less of a viable option when they hit that age of early adolescence.
Wow, it's great work.
So it really sounds like you're teaching them about having a healthy balance across the board. It's like you said, a phone is useful, technology is useful, everything in moderation, everything with a healthy balance.
Moderation, keyword, it hasn't changed over the years.
Sure.
And keep in mind, these aren't the Adam Birkenstock or Steve Chassman school of thought. We use what's called evidence-based prevention models that have been proven over time to be effective in helping young adults and adolescents learn healthy coping strategies. So it's been proven to work, and we're trained in the models. And I also think the way Adam and the team deliver it is very palatable for young people. It's dynamic, it's entertaining, I think, but it's most importantly, it's informative.
We definitely want to get into that with you on the second segment because we have a lot of things to talk about with young people. But so, Adam, you wrote a statement to the Joint Senate Task Force on Opioids, Addiction, and Overdose Prevention. Very cool. Can you please tell our listeners about that, and what was their response?
Sure. So this was, it was exciting. I got to actually talk about it, though I didn't have to read the whole statement. They didn't want me to. It was too long. As you can tell, I often have a lot to say. And the goal of the task force was to get feedback from all areas of the state on what's going on the ground, what are the key issues from your viewpoint as a stakeholder. So I had the honor to be there with a number of other stakeholders, primarily family members, and I didn't want to step on their toes with what they had to share, but it was hard not to echo in that statement that if we're not paying attention to the needs of families, because addiction is not something that just impacts one part of the community. It's not just, I'm in the throes of addiction, this is impacting me, but as a family member, you are going through addiction too. In a very real way, because you become enthralled with what's going on with your loved one, but also because you have to heal in this too. A community is impacted by this, both financially and emotionally and otherwise, at every level. And we might talk about this maybe in the second half too, there is an impact. And so that was a big piece of the goal of the statement, I will say. And talking about some of the nuts and bolts, I'm a very systems-oriented thinker. I will say people who were not a part of the key task force, that maybe not the most polite way to say it, but people who were there listening did have a lot of questions about what do we think as stakeholders the impact of marijuana legalization might be, and don't we think it's going to be great? And I said, listen, I think that there's a lot of stuff that's going to happen. We're now, in a world with legalization, in a time with legalization, so it's all done now. I said, listen, there's going to be a lot of impacts. I think it requires a lot more thinking, a lot more time. There's a whole lot that can be impacted, like we just talked about. What's going to happen if somebody's behind the wheel? We don't even have a way to test this now. Right. Is there going to be more money funneled towards addiction treatment, towards prevention, towards this, because at this point there still really is not in a meaningful or accessible way. And what are we going to do to deal with they like to call it the gray market. I don't see the point. But all of this, just now, vapes that are, not properly made, that have who knows what in it, are flooding the market. These are huge health risks, and none of it was really addressed in time. Right. So, as a prevention provider, there's lots for me to talk about, but we want to work ourselves out of business.
Frustrating.
It was very frustrating. You don't want to be, the oracle that sees things coming. You don't want to be Cassandra, right?
Right.
Yeah.
I mean, there might be, benefits as well as definite harms, such as, I'm thinking about like increase in psychosis amongst populations,
right.
Who are at risk for psychotic disorders.
Absolutely. And these are often the populations that go unrecognized or their resources aren't extended to them.
Right.
And something that's often brought up when we talk about things like incarceration rates or who's going to benefit from legalization and sale, it is an extraordinarily expensive process to open a recreational dispensary. We are talking hundreds of thousands of dollars.
Wow.
This is not accessible to those individuals who have been impacted legally.
That's true.
And there's really not been, it's a great talking point. It hasn't truly happened in a way. I hope that it can. We want people to be in good standing. Mm-hmm. We're huge advocates for the incarcerated population. We are in the Suffolk County jails every week working with the incarcerated population. We want the absolute best for them. But that's why we make these statements,
Right.
Yeah.
we want the best.
Yeah.
Absolutely.
Yes.
Steve, as of June 27th, it became mandatory for doctors and other prescribers of controlled substances to undergo at least 8 hours of training on opioids and substance use disorders. Well, some argue that this requirement is a step in the right direction. Others believe it's kind of insufficient training. What are your thoughts on this?
Well, let me preface it by saying that I'm not a physician, and I recognize that people in the medical community who are prescribers have an extremely difficult job.
Yeah.
I have a very good friend who's a physician. He said, never in the history of medicine have more patients come into doctor's office feigning medical issues that they don't have in the pursuit of obtaining opioids. Doctors treat symptoms. So to ask doctors to do, as we were talking about, SBIRT, screening, brief intervention, and referral to treatment, when they have to see 60 patients a day, we understand everyone has a busy schedule. But the truth is, history is prologue. And if we're not going to learn our lessons, we're going to be doomed to repeat. We know now, with the settlements across the country, that the pharmaceutical companies misled the medical community over the addictive properties. And there's absolutely no reason for acute pain, in this social worker's opinion, because Adam and I have been treating people on the back end of this. How many people do we know, or clients do we know, that started because they were overprescribed prescriptions from 1996 straight 100%. Up until 3 years ago?
Yep.
So everyone has some accountability, including social workers, elected officials, pharmaceutical companies, but people with DEA numbers. And these were mandates that were put forth by the Drug Enforcement Administration. Remember, if you could prescribe narcotics, you're given a DEA number. So that is federal. And also SAMHSA, the Substance Abuse and Mental Health Service Administration, have put forth these recommendations. I'm not going to say it's too little too late. As we mop up or abate the opioid nightmare that has been in America for 20 years, pharmaceutical companies played a role, prescribers played some role, and we've seen some really unscrupulous doctors on Long Island trading pills for cash or pills for sex. Every profession has their bad apples. But also, I think a lot of doctors were just, in an innocuous kind of way, or so they thought, really didn't think the continuous release of oxycodone was going to be dangerous because that's what the pharmaceutical companies told them. Right. So we now know that some of the data around OxyContin and other opioids was suppressed. They misled a whole generation of prescribers. And now, as we try to correct the past, we're asking everyone in the medical or social work or education or law profession to have continuing education around addiction medicine, because if we don't make the corrections of what we learned over the last 20 years, unfortunately, history has a way of repeating itself.
Thank you, Steve. And that wraps up the first half of our show. Play it forward. Stay tuned for the second half, focusing on community health.
So by now, everyone knows someone who has died from this cause. We must remember that these deaths are preventable. Please educate one another. Parents, talk to your kids now about this. These conversations are vital to prevent future drug use, and never underestimate the power of a heartfelt conversation with loved ones. Those can make all the difference. Fentanyl has flooded the street drug supply. Taking one pill can be a life-ending decision. One pill can kill. So we have a special song we'd like to play, and this is for Kurt's son, Jaden. This is his request, and it's a great one. It's everyone be inspired. This is Eye of the Tiger. We will be right back with our special guests, Steve Chassman and Adam Birkenstock of LICADD. You are listening to WUSB Stony Brook, 90.1 and 107.3 FM. We'll be right back. Welcome back to Play It Forward on WUSB Stony Brook. We are here with Steve Chassman and Adam Birkenstock of LICADD. Here's Chloe to continue where we left off.
So education is so important, but it's often used as a quick fix measure when it's really part of a whole systems approach. What does a whole system approach look like?
So a whole systems approach means that when you bring someone like myself into a school to talk about the latest death in your community or the latest issue that hit the news, it's a good step, and it's an important step, but it should not be your only step, and you're not going to get very far if you only take one step. So
Exactly.
it both means we have to continue to be present in the school, and not just to us. There's a lot of great prevention providers, the Long Island Prevention Resource Coalition Center, sorry, Pam, she'll know who she is a great resource for this, because you have to keep doing the work if you want to see those results. So we need to continue to have those conversations. Otherwise, we're just that person who had the one conversation one time. But it also means that if you remember me saying, oh yeah, drugs are not really a good choice for me right now, I can do these other things, and then you go home and mom and dad are like, hey, do you want a beer? Then the impact is minimal. Or you go out into your community and your community kind of runs on alcohol, or there's a lot of drugs in your community, then the health of your community is going to have a bigger impact than that one conversation that we had. So it's everything from the ground up, from the individual all the way to the whole community.
And if you went broader on that with public health, I mean, epidemiology, or the study of diseases, it's always the same. Education and prevention on the front end for people who are not yet afflicted, so they can potentially, this is from diabetes to COVID to substance or opiate use disorder, whatever disease we're talking about. Education and prevention to prevent the incidence of this illness. For people afflicted, access to treatment on demand and quality treatment. I think we're lacking.
That's
although
lacking.
we have quality treatment, it's just not long enough. And I'm very cognizant that I'm sitting next to a representative of Hope House, and Father Frank is a mentor to many, but longer term treatment, we know the outcomes are better. So it used to be, because I'm old enough to remember 28 days, and now we're lucky to get 15 or 16 when they're addicted to the most powerful products on the planet. So 28 days is likely not enough. The longer someone could stay in treatment and learn these coping strategies, the greater the outcomes. And then, of course, aftercare. Now, LICADD was one of the ones opening up Thrive, the first Long Island Recovery Center for people in recovery, so they can have safe places to congregate, to fellowship, to get wellness. So, again, that's just public health. And I started my career in HIV and AIDS, and it was the same approach from a public health standpoint. Systems. Prevention education on the front end, access to treatment on demand for those afflicted, and continuing to support people, in this case, in a recovery process that is a day at a time, but it really is a lifelong process. People didn't get sick overnight. Therefore, it's unrealistic to think they get better overnight. It is a systems that happens over time.
Yeah, and with that in mind, from the prevention standpoint and everything we're talking about, when I say, hey, school prevention is great, but we need the whole community involved, that's a 15-year process. And people often balk at that, or they say, well, I can't do that, or what does that mean? How do we do this? And sometimes I often cite, well, we've been around for 67 years. We'll be here to help you through the process. Prevention's existed for a long time. This is something that happens slowly and steadily. Community coalitions that are doing really good work do it over the course of up to 15 years. And all of that can slowly, steadily change everything from the individual, up to government.
It's incredible how you're doing work on so many different, dynamics and levels, because it's really necessarily like the family, the macro work, which can be less reinforcing because of the slow change. So it might lead people to maybe not want to be as much a part of that, but it's so necessary in like a multitude of ways, as you mentioned.
And Chloe, we'll drive home that, and Adam hit on this, with the family system. LICADD's been doing formal family interventions with a RISE-trained interventionist, which is the gold standard for family interventions, on this island for over half a century. And in fact, our clinical director is one of our interventionists. So, to your listeners, this is a family disease. So we can help our friends, our families, our fellow students, our coworkers. Interventions is a service that LICADD provides.
Steve, you recently joined Senator Kirsten Gillibrand at the Nassau County Police Department Center for Training and Intelligence to announce her bipartisan Fend Off Fentanyl Act. More than 45 other senators co-sponsor it, and it seems like it would allow the U.S. government some extra reach in stopping the illicit supply of fentanyl from getting onto our streets. Can you tell us a little bit about that?
Well, we've had a great partnership with Senator Gillibrand and Senator Schumer for many, many years. It was an honor to be called to that press conference, and I have to tell you, as you announced in the beginning of the show, this is a national crisis, but it's also national security. I mean, when you're losing an American every 8 minutes. When you're losing a whole generation of people, and I think you read the statistics that it's the leading cause of death for young
18 to
adults.
45.
Adults, yeah.
I mean, you know, there are certain states where if they're not incarcerated or deceased or in treatment, in and out, there's no one to mind the store. There's no one to go to social work school. There's no one to be the next generations of teachers. And I know you've had guests on here that have lost sons and daughters. And it's not just the loss of a family. It's what, as a nation, we're losing a whole generation of people that will choose professions and will grow up and will be contributing members of society. So when you have a federal senator saying, this is a national crisis, and to be able to call it a national crisis would free up additional funds from the federal government to treat it as a national response. So I think we've lacked, although we support this with Senator Gillibrand. You know, could you imagine when COVID hit, it was a national response. And, certain states were left to kind of make their own choices to prevent the spread of this illness. And I think we're all still recovering from what COVID did to us over the last 3 years. But you felt that federal response. Right. Why, for the last 20 years, have we been losing Americans, and every record gets shattered every year? You got to remember, 2022 was the most tragic year for opiate overdose. We were appalled, and Adam and I were working together when it was 60,000. Now it's almost double that. So we commend Senator Gillibrand for pushing that this be a federal response. It frees up additional funds to treat it as a national crisis. And hopefully little agencies like LICADD or little radio shows like yours will have additional funding to educate or to treat the community.
And a big shout out to Carol Trottier, because she reached out to Senator Gillibrand, and she told me about that, and she said she got back to me right away.
And Carol she has a personal story. I had the honor of sharing a show with her here. It is really the moms and dads and brothers and sisters and family members who are leading this charge. Yeah. Adam and I professionally, but yes, personally, we've been touched by this too in some capacity. To your point, everyone has. But the moms and the dads are really to stand up and be counted. They could shut advocates down like me, but you cannot shut down a mother or a father or a sister or a brother because, A, they're your constituents. I still fool enough to believe that elected officials work for us. Yeah. And we're entitled in this country right after the 4th of July to have a voice. And if the government's not working for us, we have a right to let them know how to do better.
Right.
Well said, Steve.
Very nice.
Thank you.
Stony Brook University, Empire State University, and Alfred State College will share nearly $3 million in state funds for scholarships to prepare students for certifications and advanced degrees in the substance abuse support workforce. The KSAC certification is one of them. Talk briefly about the KSAC certification and how this scholarship program can effectively assist those struggling. Either of you, both of you.
Well, I happen to be a KSAC and a licensed clinical social worker, so a credentialed alcohol and substance use counselor. And listen, congratulations to Stony Brook, and congratulations and thank you to the governor for allowing SUNY schools to support people. Yeah. Adam and I know, who have been in the field for many years. We're proud field instructors for social workers entering the field. LICADD is a great learning environment. And we know that in a pre- and post-COVID world that a lot of people, for whatever reason, are turning away from the field of human service. So I think we need incentives to draw people to the healing professions. And with that, I'm sure Adam has some thoughts on this too. But listen, the honor and the privilege of working shoulder to shoulder with other men and women who have devoted their careers and their lives to helping others is just a great feeling of achievement. Not that we're solving all the world's issues, but one individual, one family at a time. I've been doing it for 30 years. There is great reward in this. So.
Yeah, absolutely.
Yeah, absolutely.
Thanks, Steve.
There's a tremendous workforce challenge in the helping professions right now, like Steve mentioned. We meet on the county level, and we're a part of those workforce work groups, both in Suffolk County and we have conversations within Nassau County. Everyone's feeling it in the workforce, but people are also feeling it when they get their degrees and they think, what does it mean to be in the field? This is an incredibly challenging job to do sometimes, but also, what are those positions that are available? What does it mean to get my degree? And to ease access to this sort of education is tremendous. It's really important. And it's also a really critical, people don't often know that you need to be a KSAC to work in an OASIS center in certain positions and certain high-level positions. So it's really encouraging. I think it's important that people know how important the KSAC can be.
And it's so needed more than ever.
Absolutely.
Hey, we know 2 years ago was the Great Resignation. first responders, essential workers, of which social workers and teachers, we are essential workers. And I don't want to use a COVID phrase, but what does essential mean? Essential in helping others find their way, in this case, back to wellness. So thank you, Governor Hochul.
Yes, thank you.
Thank you.
Stony Brook. So in what ways can we get these important messages out to young people?
I think about this question so often.
$1 million
So do
question.
I.
Yeah, it's I think about this whenever I open my news app on my phone, and I think, who is opening their news app on their phone? When I'm getting, my phone knows me pretty well. They know where I live, and I'm getting news from Illinois. I've never been to Illinois. I'm sure it's very nice, but it's, how do you get that message to young people, I think is a multifaceted question. And I think it involves not just the sort of trite answer of social media, but you need young people to talk to young people. And the young people need good information, because, I had to come to terms with the fact that I no longer have like really cool piercings and a young looking face with nice skin. So like, I'm the old guy going into schools now. And even on campuses, it's like, oh, who's this dude? Is he a professor? Is he a TA in my best days? You need to have young people who care and feel like they're equipped and empowered with the right information and tools to share that information out, because the place people get their news is through various social media platforms. Twitter's, collapsing now, but maybe Threads. And to be able to get the news from there, from people they trust, from young people they trust, from family members they trust, is a really critical and important and really untapped means of getting that information out there, because it's work intensive. We really need to make those community connections.
It's so challenging.
Yeah, it is. It really is. I work with a youth group in a school. They are incredible kids, and these are kids that can really share that message out to people, but they're also really high achieving. So I know there's a couple kids that when they speak to them, they're like, you are doing so well in school. You're on all these sports. You are not me. Right? You are not the kid who goes home and is, experiencing all this trouble at home, whatever. So we need kids from every walk of life to be a part of this.
Really diverse.
Absolutely.
And when you talk about messaging in the digital and technological age, I mean, listen, I open my YouTube and I get pop-ups as to where marijuana dispensaries are. I get on my phone texts from DraftKings and where I can gamble online, and I don't gamble.
Exactly.
But how are we messaging wellness? How do we compete in the digital and technological age about...
Are we messaging wellness?
Well, that's what...
No.
I think we're trying, but just know that young people are being inundated with buying products, from THC products to online prescriptions. One of the 2 countries in the world that allow pharmaceuticals to be advertised on television. And, if you watch TV commercials, I don't know that people do anymore, you see these medications. And listen, I'm a mental health professional. Medications have come a long way for a host of psychiatric conditions, but I think we've overshot the mark. So when we talk about messaging, we have to use the internet better. We have to, everywhere you go, you see the phrase COVID-19, right? I mean, why are we not doing that around substance use or mental health? And that's something that costs a lot of money. But I'd like to see both LICADD and universities and the state and federal government use the same resources to peddle wellness and stability.
Well said.
Our organization's vision is to get this message across to young people. And one of our ideas is to appoint a couple of students to represent their school by advocating for a collective cause, a youth ambassador. Do you have any thoughts as to why you think this would be important and effective?
Yeah, it is. If there's nothing worse than someone who, and listen, I'm over 50. I'm out of the drug game a long time, so to speak. I don't mind sharing that. I'm in the field as a professional. There's nothing worse than someone 53 years old telling 17-year-olds what they need to
Back
hear.
in my day.
Yeah.
Exactly.
I mean, listen, I knew it would happen, and it was with a client just a couple of months ago where he was saying the name of a drug, and I had to lean in and be like, go ahead, tell me what that is. The names have changed. You have to know, I'm around drugs my whole life. I never heard the word fentanyl, like Adam said, until 10 years ago.
Yeah.
So the world has changed. So we need young people to play an active role. And, I'll say it again, to your credit, Taylor and Chloe and under Allison's tutelage and, Kurt, you got to lead the charge, and you got to speak the language that your cohorts of your generation speak. And you have to use the tools in which you communicate, in which to speak to them. We had a youth advisory board, and we're kind of reigniting it now. But the first thing they told us, young people, is stop making flyers. No one reads them.
Right.
Do social media posts. Do funky. No one reads, by the way. Make videos. Like, I don't come up with this. There's nothing worse than having like a county work group, and you don't have anyone who knows what drug use is all about not on that panel. Then you have a bunch of professionals, of which I'm one and maybe guilty of, a bunch of chairs, like, pushing ideas around that's not going to meet your targeted population. So, Taylor, to your question, when you have a youth group, you need young people to be well represented and leading the charge on this. And that's one of the things I absolutely admire about this radio show. You are not sitting idly and watching this happen. You are actively engaged in the solution. Radio may be a little passé, but you know what? Stony Brook radio is still cool. And,
it is. Thank you.
And listen, I still listen to Fordham radio. That's my radio station. So college radio has always had a proud tradition of progressive, being very progressive. So good for you all.
Thanks, Steve.
Switching gears, I am interested in one of the notable work events that you've been involved in. Can you please tell us about LICADD's Angel Ball and other upcoming events LICADD is having?
It's a great party. You should definitely come. So one of the things that I think is wonderful about LICADD is that we stay nimble and we stay LICADD by doing a lot of fundraising. A lot of organizations are really beholden to grants, and grants come with a lot of strings. And while we do have some grant funding, we really thrive on the generosity of people who care a lot about not just LICADD and the work that we're doing, but about the people that they love, and they want to give to a cause that they know is doing good work. They care a lot about their community, and Angel Ball is one of the many ways they get to come out and have a great time. It's a really wonderful thing. We're at Oheka Castle. We get to have a wonderful night out, a wonderful time to honor some great people in the field, some good food, some good networking opportunities to talk to people. That's a fancy way to say you're having a party, right? Networking opportunities. But Angel Ball is a kind of annual event that we get to do to not only raise money to continue what we do, but also honor that good work and the people that make that work possible. It's really tremendous. It's one of the highlights of the year.
How long have you guys been doing it?
So 36 annual.
Get out of here. 36
Wow,
annual.
that's
Wow.
amazing.
But, to Adam's point, this is not a LICADD. Yes, it's a LICADD event, and the proceeds go to LICADD, but we don't make it LICADD-centric.
No, not at all.
This is about all of the recovery community, the treatment community, people who support LICADD and all that we do. And I've said this to Adam time and time again, like, you don't fill 400 people without doing incredible work in the community. So we like to bring everyone together. LICADD is not the sole solution. We work very closely with a host of partners, including Stony Brook University Hospital and CPEP. And we bring everyone together and recognize that, yes, the disease of substance use or opiate use disorder is a crisis right now, but let us not forget that there are 30 million people living in long-term recovery from substance use disorder right now in America, and that people do get better. If you invest in LICADD or invest in recovery in whatever organization, including your not-for-profit radio station, people hear things and they change the trajectory of their life. They don't do it alone. They do it with support, but it starts with something they hear. So to that point, Angel Ball was a great success for us.
Congratulations
That's great.
on the success of that event. The
Thank you.
pictures were beautiful.
We try. We often talk about LICADD as being a bridge in the community. A lot of our services, like Espert, which we talked about, is a great service that we provide, bridging those gaps between individuals and treatment. But when we are doing our events, we want LICADD to be a bridge between different people in the treatment world, different people in the recovery world, people who are, really passionate and really care, but they need to be aware of what that treatment and recovery world really looks like to be able to.
Well, and what
to
else
put
is
those
out there,
funds Absolutely,
Yeah.
in a meaningful place. And so that's a big thing that we want these things to be. Of course, we need to run, and with the world we live in, money is a part of that, but it's about emblematically creating that bridge in the world, and Angel Ball really allows us to do that.
As
that
Father
sounds amazing.
Frank would say, thinking outside of the box.
Yes.
And that's what we're really trying to do.
Absolutely.
Peer to peer.
And that's why we raise a lot of our money privately, respectfully, and we do have partners in government today, but there was a time when we didn't, and there may be in the future when we don't again. But LICADD likes to remain, even though we're a not-for-profit, We raise most of our money privately because we don't want the government to tell us how to help our Long Island communities.
I feel like I'm sitting next to Father Frank now.
We have to, well, we're all students of Father Frank.
I know.
We'd rather go not at it alone because we'll take the partnerships when we can, but it's really important that, to Adam's point, that we remain nimble and be able to switch.
Yeah, there's so much red tape that you have to jump through and your hands get tied, and I think the ultimate goals sometimes get a little murky.
Wow. Well, thank you so much, Steve and Adam. The work that you do is absolutely amazing.
Thank
Big
you.
hand
Thank you guys.
for
Thank you guys. Thank
all
you
of
guys.
you at LICADD, your staff. You have you have a youth
Yeah.
Program?
Yeah.
Here we go.
Yeah, we really could not do it without our staff.
Yeah.
Marcy, the clinical director, everyone who is either in or not in the office because their AC broke today,
Right. Oh.
is really core to the mission, and I just want to thank them.
Big shout out to
And
LICADD.
remember, we have officers in Nassau and Suffolk, and Adam and the team, 24 hours a day.
Yeah.
631-979-1700, folks. And LICADD.org.
Thank you, Steve. And thank you again, Adam, for your time today and being our guest and all your hard work for this critical problem we all are facing. And I say all very, very strongly. I sincerely thank everyone who supports this cause and understands how important it is to look out for each other and to empathize with anyone you know dealing with addiction. Please educate one another about illicit fentanyl and various harm reduction measures, such as Narcan and fentanyl test strips. We have ample support from various community-based groups, including AA, Narcotics Anonymous, Smart Recovery, professional treatment programs, case management services, and many others.
SAMHSA's, which is the Substance Abuse and Mental Health Service Administration Treatment Referral and Info Helpline, is 1-800-662-HELP. If you prefer to text, you can text 4357, and you can text HELP for you. Likewise, SAMHSA has a 24/7 information service available that offers free confidential assistance for mental and substance use disorder prevention, recovery, and assistance. That's 1-800-487-4889. Again, 1-800-487-4889. Hope House Ministries can be reached at 631-928-2377 and found online at hhm.org. And LICADD, Long Island Council on Alcoholism and Drug Dependence, provides crucial support, intervention, and professional guidance for individuals, families, and children dealing with addiction. LICADD's hotline number is 631-979-1700, and the website is licadd.org.
Fentanyl test strips are available at many harm reduction organizations and available through dancesafe.org and Amazon. Also, LICADD has them available for Long Islanders and their free Narcan kits. Please, please have Narcan accessible. You never know whose life you may save. For those who are not seeking recovery or treatment or an abstinence-based thing, Never Use Alone hotline is an overdose prevention service for people who are using substances alone. They'll stay on the phone with you and chat totally judgment-free while you use, and if you become responsive, they will send for EMS, never police. They have saved at least 88 lives so far, and their phone number is 1-800-484-3731. Again, 1-800-484-3731. There's also an organization called harmreductionworks, which is a recovery organization that supports harm reduction and has meetings and community support for those who are looking to connect who do not want an abstinence-based model.
On behalf of Play It Forward, thank you all for listening. We invite you today to join us on Instagram to see behind-the-scenes content, ask us questions, share your thoughts and ideas, and be part of our dynamic, growing community striving for fentanyl awareness and prevention. We genuinely want to hear from you. Our Instagram is sbu.playitforward and our YouTube, The Play It Forward Project. We hope that our message reaches somebody, so for now and always,
Keep playing it forward. All right, thanks, guys. So this is Allison of the Play It Forward Project, and I hope you tune in to our next show on July 21st from 1 to 2 p.m. Our next guest will be Dr. Jeffrey Reynolds, President and CEO of Family and Children's Association. Great guy, great guest. Again, thank you, WSB, the Play It Forward hosts, Kurt, Taylor, and Chloe, and of course, to our special guests, Steve Chassman and Adam Birkenstock of LICADD.
It's an honor to be here.
Thank you.
Thank you again.
so much.
Thank you so much for your time. And so we have a special song we're going to play, actually, Steve's request, George Michael's Faith. You are listening to WSB Stony Brook 90.1 and 107.3 FM. Be well, everyone, and please look out for one another.
Well, I guess it would be nice if I could touch your body. I know not everybody has got a body like you, but I gotta think twice before I give my heart away. And I know all the games you play because I play them too. Oh, but I need some time off from that emotion. Time to pick my heart up off the floor. Oh, when that love comes down with a devotion, well, it takes a strong man, baby, but I'm showing you the door. 'Cause I gotta have faith. I gotta have faith. Because I got to have faith. I got to have faith. Baby, I know you're asking me to stay. Say, please, please, please don't go away. You say I'm giving you the blues. Maybe you mean every word you say. I can't help but think of yesterday and another who tied me down to lovable rules. Before this river, there comes an ocean. Before you throw my heart back on the floor. Oh, baby, I reconsider my foolish notion. Well, I need someone to hold me, but I wait for something more. Yes, I gotta have faith. I gotta have faith. Because I gotta have faith. I gotta have faith. Just have to wait because I got to have faith. To have faith before this river, there comes an ocean. Before you throw my heart back on the floor. Oh, baby, I reconsider my foolish notion. Well, I need someone to hold me, but I wait for something more. 'Cause I gotta have faith. I gotta have